The number of COVID cases in children is spiking nationwide just ahead of the Thanksgiving holiday. Pediatric infections have jumped 32% from 2 weeks ago.
So here this afternoon to answer your questions is Dr. Todd Ellerin, Chief of Infectious Diseases and Social Health. Dr. T, it's great to see you. The American Academy of Pediatrics says that COVID cases in children accounted for about 25% of the total caseload last week. I have two questions for you. And forgive the simple nature of this question. What is a child? And then how concerning is this trend?
Well, it's a good question. Sometimes you think that a child would be anyone that's under 18, but I think sometimes it's used to think about a child that's under the age of 12. In any event, here's the bottom line. Children are making up a quarter of cases, as you've heard. It's been like that for a while. There's been over 142,000 children diagnosed with COVID last week. And over about the past few months, they've been over 100,000 weekly. Now, remember, kids are a microcosm of the U.S. We're seeing increases in COVID in all age ranges, including kids. So what it really means is it underscores the key of getting our kids vaccinated. And for those that have children under the age of 5 who are not eligible, making sure that as many of us are vaccinated around them.
So obviously, this is concerning with families for gathering for the holiday, some for the very first time that they've done this in a long time. So what should parents be thinking about when it comes to protecting kids?
It's a great question, Maria. And first of all, I just do want to say that Thanksgiving is around the corner. And I want to say thank you to you guys and, of course, everyone in the U.S. that has helped us through the past couple of years that have been so challenging. I know that all of us are doing so much to try to protect each other. So thank you out there. So I think the key is the things that we've always done. Remember, we've been through a COVID Thanksgiving before. Testing, asking people to show up with negative tests is one thing. Masking indoors, of course, getting vaccinated if you're unvaccinated. Now, it's true, we're too close to Thanksgiving for that single dose of vaccine to work, but a booster could work if you're fully vaccinated. But remember, we're not just thinking about Thanksgiving because this virus is not going away. It's going to be with us for a long time.
Right.
So remember to vaccinate, ventilate, validate. I've said that before. Ask people, know who around the table is vaccinated. Make sure you keep those that are unvaccinated away from those that are, most vulnerable at the other end of the table. That distancing. Those are some of the pandemic tricks that can work to protect us this holiday season.
Dr. T, we now know that kids 5 and up can get their COVID vaccine. So remind us, if you would, of just how much protection that offers if they have just gotten that first dose.
Right. So we know through the adult studies that first dose at around day 10 did offer significant protection. The one issue, though, is with Delta, that single dose is not as effective at day 10. So for those kids or adults even who've only had one dose, I think we have to consider them more functionally unvaccinated. It's that second dose that's really important to get full vaccination effect.
Got it.
So, Doctor, last year we were talking about changing how we were going to serve Thanksgiving dinner, possibilities, don't share plates. That's just to remind people, it's okay to do that now. That is not needed, right?
Absolutely. Now, remember, hand washing is still important in general, but we don't have to go crazy. Surface contamination is not the way this is spread. I do want to say one thing to you guys. I'm taking care of a young kid right now, 21 years old, who's unvaccinated, who's really sick with COVID. Just a reminder that we need to be afraid of COVID, not the COVID vaccine. I spoke to another younger child whose parents are, whose grandparents are upset because the parents are not vaccinating that child. And the child actually said to his grandmother that what he's most afraid of is the COVID vaccine and not COVID. Once again, I want to reiterate, it's COVID that we have to be concerned about, not the COVID vaccine. The COVID vaccine has proven track record to be safe, effective, and can keep us from getting infected and transmitting. Please talk to your children today about that. We want to model good behavior. As parents, please get vaccinated and please get your kids vaccinated.
Great clarity, Dr. T. Thank you very much.